Developing young brains are in danger. A U.S. official is calling it the worst mental health crisis in recent memory. Surgeon General Vivek Murthy issued a warning today about social media and the impact it has on kids and teens. In an advisory released this morning, he said based on the review of new data, there isn't enough evidence that social media is safe for kids to use. The Surgeon General's new report comes in the wake of a recent research report that shows kids between the ages of 12 and 15 who spent more than 3 hours a day on social media are at more risk for mental health problems compared to those who spent less time on their screens. And a recent report by the American Psychological Association showed an increased risk of anxiety and depression among adolescents who are exposed to criticism, discrimination, and bullying online. But Murthy says social media isn't all bad for kids. He says it can be helpful in connecting kids and providing support and information. While the Surgeon General's report suggests social media can significantly impact a child's mental health, children are locked into their screens. In a story we reported last week, a recent poll showed teenagers and young adults favored their social media platforms over their own right to vote. The survey by Reboot Foundation revealed that 59% of young adults and 64% of teenagers indicated that if forced to choose, they would pick to maintain access to their TikTok accounts over keeping their voting rights for 1 year. In a separate survey by Real Research, more than 63% of teenagers polled said they spend 5 or more hours on social media every day. This is why Murthy says more needs to be done to keep them safe. The Surgeon General's advisory is calling on policymakers and tech companies to take steps to minimize the risks of social media by developing age restrictions and safety standards. It is also asking for more transparency from big tech when it comes to the data it shares. Murthy is suggesting a scientific advisory committee aimed at creating safe online environments for children, especially since suicide is the leading cause of death among young people in the United States. A new study examined national youth suicide trends and characteristics in the United States before and during COVID. The research team, supported by the National Institute of Mental Health, analyzed national suicide data from the CDC. The study shows that 5,568 youth died by suicide during the first 10 months of the pandemic. That is higher than the expected number of deaths had the pandemic not occurred. Suicide deaths involving firearms were also higher than expected.
What sets Straight Arrow News apart from the other guys? Well, for one, we're on a mission to serve you, not an agenda. So for factual, trustworthy reporting, head to straightarrownews.com.